How do you know? I guess you guys probably have been practicing questions and reading and studying. Some of you have taken my review, some of you haven't, but I want to see exactly where you are. So I got some NCLEX questions for us to do. This is how it's going to work. I'm going to show you the questions. I want you to try to figure them out on your own. Questions from 1 to 10, and then we will go over them together. All right, and I'll tell you guys the answer and why it's the right answer. So get your thinking caps on. We're getting started right now. Now let's take a look at what the correct answer should be. Question number 1. The nurse is caring for a child with hemophilia who falls and cuts his leg. Which action is essential for the nurse to take? That is going to be A, applying direct pressure for 10 minutes. The others are good, but A is the best choice. Number 2, the doctor gives orders for Synthroid 75 micrograms PO for a client. The nurse will give the client the following instructions. It's going to be D, take this medication on an empty stomach. You guys got to know Synthroid needs to be taken on an empty stomach. Moving on to 3, a client is admitted to the intensive care unit for a blood sugar of 900. The doctor orders the nurse to administer insulin via the IV route. The nurse knows to prepare which type of insulin for injection. That is going to be B. Regular insulin is the only insulin that can be given via the IV route. Now, number 4, the nurse knows that the 5% dextrose in water is which type of solution? That's going to be A. Isotonic solution. D5W is an isotonic solution. Number 5, a client is admitted to the ER with a broken clavicle. The doctor orders morphine 4 milligrams IV. The nurse administers the medication and the client states all of his pain is gone. No other orders have been written for this patient except prepare for clavicle repair surgery. 4 hours later, the client is complaining of extreme pain and needs to be transported to the surgical unit. The nurse administers morphine 4 milligrams IV and the client states his pain is relieved. The answer is A. The nurse acted inappropriately by giving the medication. She had no order to give a repeat dose of morphine 4 milligrams. This is an illegal action by the nurse. Now let's look at number 6. The doctor orders Pyridium for a client with a bladder infection. The nurse knows which teaching to include before administering this medication, and that's going to be B. This medication will cause reddish orange urine. Number 8. A patient with AFib is now ordered to take Coumadin 5 milligrams PO daily. The nurse is aware that the client understands the effects of this medication by which of the following statements? It's going to be B. I will avoid eating green leafy vegetables, which may clot my blood, okay? A client's morning blood glucose level is 278. The nurse administers 22 units of NPH insulin at 7 a.m. When should she assess the client for a hypoglycemic event? That is going to be C, 4 p.m. To answer this question, you have to know the peak time when intermediate insulin is at its highest, and that's going to be 8 hours. So if you do 7 a.m., count forward 8 hours, you'll get 4 p.m. A 66-year-old was admitted to the hospital for frequent falls and loss of appetite. The woman is also experiencing right-sided hemiparesis. The nurse expects which diagnostic procedure to be ordered. That is going to be B, the CAT scan. We want to know what's causing this paralysis. Could it be a bleed in the brain? If so, only the CAT scan will show us this. All right, guys, those were the answers. Whew, that was a hard test. No, it should have been easy. Actually, you guys should have gotten at least 8 out of 10 of those questions correctly. If you did, great job. You are on the right track, okay? You are ready for NCLEX. If you didn't, if you got less than 8, you got like 4 or 5 of those answers right, I would be a little bit worried about taking NCLEX, okay? Because those questions were a lot of content questions, pretty straightforward. So let that be a true reflection of where you are. Use that information to continue on your studying, okay? You guys have to take this test seriously. It's difficult, but you're doing a great job. You guys are watching the videos, you're going back and studying, so I expect you to do that every day until you take your test, all right? You only get 1 day off when it comes to NCLEX studying, and that's the day before the test. So, great job, guys. Don't give up. We're almost there, and I will see you soon.